this is the recording for the High Vault lab or the High Vault skill check. And the first thing I'm going to do is I'm going to scan the room. And then I'm going to show you my machine, and then disperse pad, and then the active pad. Can you see it? Good. Okay. And I have patient 2. Knee replacement. Okay, so I'm hand sanitizing. Hello, Mr. Slavo. How are you doing today?
I'm doing great. How are you?
Good. My name is Jen. I'm going to be your student physical therapist assistant this afternoon. And I see on your chart that you had a total knee replacement on that right knee just a little bit ago. Doesn't say the time frame. How are you feeling?
I'm all right. I'm in pain.
You're in pain? We're going to try and decrease that a little bit for you, okay? So, before we get started, can you tell me what your pain scale is right now?
It's like a 6.
6? Okay. Let's see if we can bring it down a little bit. So what we're going to do is your plan of care on your chart says that we're going to try and reduce some of the swelling in the area or edema that you're having. And also on top of that, we'll decrease some of that pain as well. We're going to do that by high volts, pulsed galvanic current. So what we're going to do is I have these 2 pads. This little pad here is going to be your active pad, and then this bigger pad here is going to be your disbursement pad. And the active pad is going to be down here underneath the swelling that you have, and then the disbursement pad is going to be up a little higher. And then the active pad is going to have a negative polarity to it. And then inside your edema and the swelling that you have what's called plasma proteins that also have a negative polarity to it. I'm going to elevate the limb, elevate your lower leg so it's elevated above the heart, and then with the negative and a negative, it's going to push that it's going to push the swelling and the edema out of the area to your lymphatic system. It's going to go filter out through to your heart, then to your kidneys, and you're going to secrete it out through your urine. Okay. Again, it's going to decrease some of your pain as well. This whole thing is not going to be no pain at all. It's supposed to be nice and comforting and calming and relaxing. Okay. Do you have any questions so far? Good. So I'm going to have you roll your shorts up. I'm going to clean your skin, inspect the skin, elevate the limb, things like that. We're going to have to do some hands-on stuff. Is that okay with you?
Yep.
Great. Also, just a couple things to go over. Do you have a pacemaker? I don't see it on your chart, but do you have a pacemaker? Okay, good. And we're not placing the pads of your carotid sinus, so that's good as well. When I check the skin, I'm going to make sure there's no active bleeding happening at the area, and then your skin has not been. There's no anesthetic in the skin at all, correct? We're good? Okay, great. So we're all good to go. Do you mind going ahead and rolling up your shorts for me? I need it to be right about up in here. Perfect. You go ahead and elevate your leg. You can't do that.
Wow.
Thank you, though. I'm sorry if my hands are cold. Feeling okay?
Yep.
All right. So I'm gonna go ahead and take my little active pad. I'm gonna go right on. Oh, you know what? I'm gonna take a measurement right around the patella. I got you at 49 centimeters. And then you said your pain was a 6 out of 10, right?
Yes.
Okay, I'm gonna go ahead and clean the skin, check the skin. Looks nice and normal, just a little bit of swelling. We're all good. Okay, you wanna go ahead and place those pads down. And the disbursement pad, I'm gonna put it right up here. How are we doing?
Good.
Good. All right, so I'm gonna go ahead and set my parameters. Again, I'm still using the same paper. So when we turn this on, it's just supposed to be a sensory feeling. It's not supposed to be contracting any muscles or anything, and it's not supposed to be painful, just a nice constant feeling of maybe vibration or a tingling sensation, okay? So we're gonna go ahead and set the polarity. Polarity is gonna be negative. We're gonna put the pulse duration at 90 microseconds. The frequency is gonna be at 100 pulses per second. And I'm gonna go ahead and switch my machine on and we're gonna turn it up. Again, the machine is only supposed to be a sensory feeling. So I'm gonna go ahead and turn this up, turning it up. Let me know when it feels okay.
It's okay.
All right, so we're gonna stop there and it's gonna be at 14 milliamps. We're gonna leave this on for about 30 minutes. I'm gonna leave you a timer and a bell right here. If anything feels like it's off and you're uncomfortable with it, make sure you ring that bell and let me know. I'm gonna come back in 5 minutes to check on you. But again, this is gonna be on there for 30 minutes, okay? I'm leaving, coming back. It's been 5 minutes. How are you feeling?
Fine.
Fine, okay, good. No pain or anything? Feeling
No.
the same kind of constant sensation? Okay, good. I'm leaving. Oh, ding, it's done. Okay, I'm gonna go ahead and turn my machine off. I'm gonna take the pads off and then I'm gonna check your skin again and take that measurement. Can you go ahead and tell me what your pain is now?
It's like a 4.
Good, okay. So the skin is looking good and intact. I'm gonna go ahead and take that measurement again. And like I said, it was at 49 before. And we're at 43. So that's a lot better. We're all done for today and we're gonna go ahead and do some stuff with your treatment. I know that the pain might be down and the swelling might be down a little bit too, but just take it easy. We don't wanna aggravate anything. We wanna keep this going throughout the day. And if everything feels okay, we're gonna continue to do this throughout your treatment, okay? Any questions?
Do I have to keep my leg up like this?
Right now you don't, because we're gonna do some exercises, but the more you elevate it, the more that it's gonna reduce the swelling and come back to the trunk of your body and filter it out. So the more you have it elevated, the better, yeah? But you don't have to.
Okay.
Good. Real quick, I'm gonna put the pads back on so you can see where I put them because I know I didn't lift it up and show you. And then, can you see?
Yeah.